Hi, everybody, and welcome. Welcome to the Lafora Talk Show. This is season 3, episode 10. We are very excited today to present an important topic. We're going to be talking about the NCLEX exam and specifically about next generation NCLEX. And we have a bonus class coming to you today as well. I am your host, Tanya Friedman, CEO of Kinetics USA, and I'm joined today by Paul and by Rachel, who are going to be sharing their insights, tips, and pointers about the NCLEX exam, and more specifically about how the next generation NCLEX is going to have implications for international nurses. Welcome, Rachel. Welcome, Paul.
Good morning.
Good morning, Tanya. Good morning, Paul.
Morning,
Good
morning
morning,
to both of
Rachel.
you. And if you are watching from anywhere in the world, please put into the chat where you're watching from. It is so fun to see all our viewers that are watching from all over the world wanting to learn from our experts, Rochelle and Paul and Dr. Paul. I see we have Vinod saying hi. I see we have Kay. Oh, how great to see Kay. Jasmine's watching from Australia. So if you're watching right now, please put your questions into the chat for the panel, and we would love to hear your views and your input about the NCLEX exam, as well as how next generation NCLEX is going to impact nurses from all over the world. So let's start off with introductions. I know probably Rochelle and Dr. Paul don't need any introductions in the fora or onwards and upwards, but let's start with that anyway. And ladies first.
Hi, a pleasant evening to all our viewers here in the Philippines. Good morning to those who are in the USA. And good afternoon to all those nurses who are in the Middle East and wherever you are, wherever your location is. Welcome to our Lifora Talk Show today. I'm Rachel Olivar. I'm one of the founders of iPass Processing. In iPass, we provide assistance for the NCLEX USA, NCLEX Australia application. And we also have our NCLEX online review program through the iPass Online Review and Mentoring Academy. We've been in partnership with Kinetics USA Nursing for quite some time now, where in iPass
We love
process.
iPass.
Tanya. Thank you, Tanya. It's really an honor for us. We're in iPass processes their candidates NCLEX application, and additionally, some of the Kinetics scholars are also enrolled in our NCLEX online review program.
Thank you, Rochelle. So we are very proud and excited to have Rochelle on the show today. iPass is a great partner of Kinetics USA. We have many nurses going through an NCLEX scholarship, and iPass have done an amazing job for international nurses. I see we have people that are joining us. So we've got Jasmine is from Australia. We have Akbar from Iran, and B from Maryland, and Mary from Riyadh. So many people joining us. If you have questions about the NCLEX or the next generation NCLEX, please put them into the chat and our expert panel will answer them. And then Dr. Paul, go ahead and give an introduction.
Good morning, everyone. I'm streaming live from Houston, Texas. My name is Paul. In social media, I am Dr. Nurse Paul. I am an admin of Lefora Group. It's the biggest Facebook group for nurses migrating to the United States with 168,000 members. That's how I met Rachel, and that's how I met Tanya. I do a lot of info sessions as well on my Facebook page, Dr. Nurse Paul. I've been doing a lot of live shows for next generation NCLEX, and I'm happy to be here today to share my expertise. I am also the CEO of Aspire R and NCLEX, currently also in partnership with Kinetics USA for their scholarship program. And we've been doing a lot of NCLEX classes almost every day. We've been operating here in Texas for 3 years now and continuously expanding. So if that's something that you guys are interested, you can send me a message, or Tanya as well, because she provides scholarship to nurses. Thank you, Tanya.
Thank you, Dr. Nurse Paul. And I think that for any nurse who is watching this for the first time and is wondering where to start, the NCLEX is the place. So this is a very, very important show for any nurse who's wanting to come to the United States. I see we have Peace from Nigeria, Frank from Ghana, Sakina from Riyadh. So many people joining from all over the world. It's so fun to have everybody watching and sharing the information. The Lafora Talk Show is all about information and nurses helping nurses. Information is empowering. And that's really what this is all about. So both Rochelle and Dr. Nurse Paul, thank you for being here and for sharing your expertise with everybody watching around the world. All right, so let's dig in. Oh, and before we do that, I just want to give a shout out to the Lafora admin team, to obviously Nurse Paul, to Miss Jean, who's Rochelle's sister, to Nurse One, to Louise, to James, to all of the, to Anna, to Kay, all the amazing admin of this Lafora, who do such wonderful ways of giving back to the nursing community. So thank you for giving the opportunity to share this information. All right, Rochelle, for any viewer that is watching right now who's joining for the first time, thinking of coming to the United States, but really doesn't know what this is all about, what is the NCLEX and why is it important?
So NCLEX stands for the National Council Licensure Examination. It is designed to test the knowledge, the skills, and abilities essential to the safe and effective practice of nursing at the entry level. There are two categories, the NCLEX RN and NCLEX PN. Both of these exams are in variable length, computerized, and adaptive tests. The NCLEX is only provided in a computer adaptive testing format. Currently, we have 75 to 145 items for the NCLEX RN. Regardless of the number of the items administered, the time limit for this examination currently is 5 hours. The exam is administered by Pearson V Testing Center, and only nursing regulatory boards can release the NCLEX results to the candidates.
Thank you, Rochelle. Dr. Paul, why is the NCLEX important? You're on mute. You're on mute. Oh.
Sorry. Have a little pharyngitis, so I have to mute my mic. Anyway, like what Rachel said, NCLEX is the licensure examination. Here in the United States, you need to pass the licensure exam to be able to register as an RN or as an PN to practice as a nurse. You cannot be hired or employed here in the United States without your RN or PN license. In the very similar manner where immigrant nurses come over here to recruitment agencies and direct our agencies like Kinetics USA, your petition for immigration will actually not be started. We will not be able to petition you without your NCLEX. So NCLEX is very important, one, to practice as a nurse here in the United States, and two, for immigrant nurses to be able to start the petition to get you here to the United States. And the sooner that you can get it done, the faster that the immigration services could start with your petition.
Okay, thank you. So I heard one nurse tell me once, it's the key that unlocks the door. So
Right.
I think that's kind of a good way of putting it. If you look at the Kinetics USA website as well, we have our success path, which gives you a very good itemized way of exactly how to get to the United States. And you'll see number one on that list of 7 items on that success path is the NCLEX Fast Pass Blueprint, which is the first step, the key to unlock the door, as we say, in order to come to the United States. Rochelle, can you tell us a little bit about the application process and who qualifies to take the NCLEX?
So, Tana, there are 50 states in the USA and 4 US territories. So, each of the states and its territories has its own board of nursing, which is a member of the National Council of State Boards of Nursing. The Board of Nursing is responsible for the evaluating the licensure application for each candidate, and they have different requirements and procedures that an interested applicant must follow to be approved for the NCLEX examination. So to qualify for the NCLEX, basically one must be a graduate of an approved nursing education program. So for the eligibility requirements, it varies from each state board of nursing. But as an overview, a candidate must complete an application with a chosen board of nursing. Some states have requirements such as the evidence of English language proficiency, or an applicant may need to complete a fingerprinting procedure. The board might require the applicant to complete courseworks or evaluation of credentials through a credentialing party. So the application or the qualification, I mean to say, and the eligibility requirements in taking the NCLEX will vary on which board of nursing we applied for the NCLEX.
And it can be very confusing. So if you are confused about that process, then iPass is a great partner to help you to navigate it. It is possible, of course, to do it on your own, but it is confusing and there are a lot of requirements. It's something that you can't just kind of jump into. Am I right, Rochelle? You've got to do some planning.
Yes, it's a complicated procedure actually.
Okay, so Dr. Paul, we have a question in the chat from Julina. Julina is watching from Dubai. I have my NCLEX RN scheduled in a month. Where can I reach out to get a crash course, please? And is this
So you can
advisable for nurses to do a crash course?
Well, the thing is, it really depends on your preparation level. So some nurses would have prepared months prior to their exam. They can join the crash course. So crash course are meant to like enhance what you already know, improve what you already know, and give you little more tips. But it's not, of course, because it's crash course, it's rapid course. It's not meant to replace the comprehensive course where it builds on your foundation and your test taking strategies. But if this is something you're interested with, I offer crash courses for 10 days. I have a batch coming up on December. Give me a message on my social media at Dr. Nurse Paul, and I could help you for that or with that.
Okay, and this is what we love about the Lafora Talk Show is nurses helping nurses. Jelena, best wishes with the NCLEX exam and for any nurse who's going to be taking the NCLEX exam soon. Rochelle and Dr. Paul, do you want to share your experiences of taking the NCLEX?
Dr. Paul
Ladies
first.
first. Rachel.
It's your turn.
Okay, all right.
Back and
Well,
forth, back and forth.
it's funny because I took my NCLEX a long time ago. Took my NCLEX 2008. Some 15 years ago. I was fresh off of college. I didn't have nursing experience. But I know that I took nursing so I can get to the United States because I mean, from the Philippines, your parents would prime you to, eventually go to the United States. That's why you took up nursing, right? So as soon as I passed the local boards, I submitted my application to the United States, and it took about a couple of months to get my eligibility. Took my NCLEX in 2008. Although it's been 15 or 16 years, I still remember it to be very nerve wracking. Took me almost off of my seat with how anxious I was during the exam. All I remember was I do not remember the exact questions. It was a long time ago, but I do remember the feeling. It was a bit traumatizing to say the least because it was expensive, it was very difficult, and I know my future career hanged on it. But was able to pass it and eventually got recruited for the United States. But nevertheless, um, at that time, because I grew up poor, so I didn't have finances to put me in scholarship programs or review classes. So I had to like exert extra effort, double the effort to prepare myself because I did self review. But I'm happy that we're doing shows like this because we can, provide few hours of classes every now and then that nurses can really take advantage of if they don't have the finances to enroll in review classes like what I provide. But even then, Kinetics USA have provided scholarship programs, and there's hundreds of scholars that are enrolled in our program right now under Kinetics USA. And if that's something that you're interested with, please get in touch with the recruiters at Kinetics USA, and they can get you on board with scholarship programs.
Yeah, it's expensive and it's really quite dicey to be able to take the NCLEX without doing a proper review course. So, if you, I see we have a question here about the NCLEX scholarship, and I would definitely suggest that you apply online and that and that, we can see if you meet the requirements for selected nurses. We work with both IPAS and with Aspire in terms of the NCLEX scholarship and have seen incredible results. And in answer to the question, the requirements are that you would meet the eligibility requirements that Rochelle has she's nodding her head, that nurses are required to meet in order to take the exam, and also that you would pass a predictor test. So both IPAS and Aspire will administer a predictor test, and if you pass that predictor test, you can be eligible for the scholarship. Um, Rochelle, I see we have a question here from Diana who's saying, I'm from Ghana practicing midwifery. Can I apply for the NCLEX? What would you say to Diana?
For usually they require the nurse to have to be able to graduate a nursing program. Usually for international educated nurses, they consider the diploma in nursing and the BSN. But I'm not so sure with with midwifery. We have to probably you can probably submit your application to the board, because it's really the board of nursing who can decide. They have to go through your transcript of records. They have to go through the education that you had, and then they are going to let you know whether you are eligible for the NCLEX or not.
Okay, so Diana, it is going to be a process that you're going to need to go through in order to see if you qualify. So I see we've got Sarah from Zimbabwe, Mercy from Zambia, Ashkar from Pakistan. So lots of nurses joining from all over the world. Um, Dr. Paul, how long should a nurse study for before they actually take the exam? Or how long should they be in a review course, ideally, if they're going to be?
So yeah, this is a very individualized question, but for the most part, standard or average time of preparation in the study plan that I created for Aspire RN, we have a 2 month, 4 month, 6 month study plan, but the most popular is 4 month plan. In the 4 month plan, study plan that I developed, it's 2 months or 8 weeks of comprehension building or concepts building, 4 weeks of test taking strategies, and 4 weeks of final coaching. So that's what I do. But again, some students, for example, they've been out of nursing field for years. I had a student recently who passed. He graduated from 1995, and he's never had a nursing experience. He worked somewhere else outside healthcare. So of course he passed the NCLEX one time under my guidance, but it took him a while to really prepare. And I'm glad that we're doing a lot of personal mentorships because he was able to listen to me. It took him about 6 to 12 months to prepare because of the length of time that he was out of the nursing field. But there are nurses who are currently practicing or who has just graduated. 2 to 4 months is already enough for them to prepare. There are high performing students that are very smart from the get go. They probably need just 1 month or 2 months. The crash course would serve them well. So really, the average is about 3 to 4 months. Um, but it still depends on the individual performances. If you guys are on the fence of deciding how long should I prepare, maybe I can help you with that. Let me know. I can give you a probably an evaluative exam and tell you what I, on my honest opinion, could prescribe you what type of study plan you can enroll, whether you enroll with me or somewhere else, but at least give you an idea of how long you should be able to prepare.
Okay, well, thank you for that. So it seems like it's on a case by case basis, but on average, about 2 to 4 months. Rochelle,
Mhm.
how long does it take on average to be able to get the eligibility and the ATT to take the actual exam?
Well, across all boards, usually the processing time frame right now is about 6 to 8 months. So we first have to do the credential evaluation. It can be through a third party service provider, a credentialing agency. And then we submit the application to the Board of Nursing. As what I've mentioned earlier, there might be courseworks that you will be required, fingerprinting that you have to do. So this takes a while, and then after some time that you are already done with everything, then you are approved for the examination. But usually the processing time frame right now is about 6 to 8 months before you will be approved. And
All right.
then once you're already approved, then you decide whether you are ready to sit for the exam. Then we can proceed with the Pearson View registration. Or if you're not yet ready, then you have to still continue your preparation for the NCLEX.
Okay, so that gives you a good idea, everybody, of how long it takes from a processing perspective. And then it's kind of to combine those two factors of your study review program as well as the NCLEX application. So it's not an easy process, especially if you're working and you've got family and there's a lot to take care of. And it's going to get a little bit more complicated, everybody. So put on your seatbelt and let's now move to the next generation NCLEX. And what is that all about? So first of all, Dr. Paul, who or what makes the decision to change the NCLEX exam, and why did they do that? Or why are they
Yes.
going to be doing
Yeah, so I think I want to share my slide right now. There you go. So the NCLEX, the changes to the NCLEX, number of items, content, study plan, these are all decided by the NCSBN, or the National Council of State Boards of Nursing. These are all the boards of nursing from all the 50 states plus Canada. So they all convene every now and then, usually every 3 years, before they change the test plan and content or the passing rate. But in the last 10 years, there has been a push for a change in the NCLEX. And now we have confirmed that come April 1, 2023, there will be a significant change. This is what we call the next generation NCLEX. So what really is the next generation NCLEX? Next generation NCLEX is a new type of exam where there will be 14 different types of questions, three different types of scorings, and so many other changes. It will get, or it will make the NCLEX more complicated. And the reason why we're doing this is a lot of questions that get asked of me when I did my show about 3 weeks ago is, why change the NCLEX? The reason is this: clinical judgment is the reason. They have seen in the literature studies that they did in the last 10 years, plus the survey of the nursing community, of all the stakeholders in the healthcare, including the Department of Labor. They have found out that the most important skill of a nurse is the clinical judgment or critical thinking. However, the current setup of the NCLEX that we're using right now does not necessarily, or does not measure the clinical judgment directly. There are three things that they found out in their study. And the first one is, clinical judgment is a very important skill for entry level nurses. Here in the States, the complexity of healthcare is continuously evolving. They say it's becoming harder to become a nurse now than before because of the complexity of the diseases, new evolution of viruses, and it is important for nurses to have clinical judgment. The second one is, clinical judgment is heavily integrated in nursing practice. About 46% of all vital nurse duties or responsibilities at the bedside is anchored in clinical judgment. And number three, this answers our question: in the current NCLEX setup, clinical judgment is not measured by current NCLEX. So because of that, the NCSBN, the board that creates the changes in the NCLEX, created what we call the or the NCSBN clinical judgment measurement model. And this is how they create the new NCLEX. But I'd like for us to focus on the clinical judgment elements in the current, in the NGN Next Gen NCLEX. We will be tested under these 6 categories of the assessment elements. Think about your nursing care plan, think about your nursing process, from assessment analysis to planning, intervention, and evaluation. It's the same thing. They just reworded it, but in a manner where they can accurately or directly measure it through the examination. And later on, I'll tell you what are those specific changes that they'll do to monitor or measure the clinical judgment through the examination.
Okay, so this is going to be a big change, everybody, and it's really important to understand what that change is and how it's going to, what the implications are going to be for nurses around the world. Rochelle, in your opinion, what do you think is going to be the biggest implications for any nurse who has not yet passed the NCLEX exam, besides the fact that if they can, they should try and take the NCLEX before April next year?
Well, with regard to the application procedure or the licensing process, actually there will be no change as to the process. There is no effect because there's no change as to the requirements of the application. But however, what we are seeing right now is that um, everyone is in a rush to be approved for the exam. Everyone is in a hurry to sit for the NCLEX, so that they cannot be so that they will not be sitting for the NCLEX by April of 2023, in which this feeling is really understandable because it's new. So there is an increase in influx of nurses applying for the NCLEX, but the same thing that will happen with the processing time frame, because it will not change yet. There's no change as to the processing time frame, therefore the application will just be the same. And as with regard to the test candidates, I think um, since it is a very new, some of the nurses are getting hesitant to sit for the NCLEX. And but what I can say is that they just have to also master the concept. They have to do a lot of preparation as well, do a lot of practice questions, because as we are going to get along with this and ngn format, they will be able still to ace their NCLEX.
Okay. So there are going to be, so no real change in terms of the processing for the application at this stage, but obviously going to be changes in the actual test.
Mhm.
Dr. Paul, what are the changes in the new NCLEX, in the
So,
format specifically?
yeah, by the way, before I proceed, I would like to add to what Rachel said. I agree with Rachel that yes, the exam is changing. Yes, you need to prepare for the exam. But the unfortunate part of it is the processing times for application does not change. So some boards actually take months to get to eligible. So that's something that you guys, the you nurses, need to consider. Do not force yourself to actually take the exam before the engine if if there's a
If you're not
very
ready.
small reason, or yeah, if you're
Doubtful.
not ready, and if also if you're not eligible because you're not really going to be able to take the exam. So I guess the key takeaway there is we always say this in the ER, being an emergency provider, we always prepare for the worst, hope for the best. So yes, if you can take it before NGN, sure. But if not, at least you prepared for the worst, right? So there's no going away from it. There's no way that we can turn our backs on it. It's gonna happen. But at least prepare yourself if that's gonna happen, right? Anyway,
Yeah.
Also,
the change.
adding to that, Dr. Paul, they have also to take note that the format of the current NCLEX will still be applicable by April of 2023, although there will be additional new test formats. So they just really have to master the concept, because hypothyroidism in the current NCLEX is the same hypothyroidism when NGN comes. They just have to get familiar with the new format. They need to educate themselves with regard to to the changes, and do a lot of practice questions.
Yeah. I
Correct.
think the
Correct.
key
Agree with
word,
that.
the key thing that I think is coming across from the experts is the preparation. Because
Yes.
it's new, it means that nurses had to prepare well before next generation, and they're going to have to probably prepare even better going forward, right? Everybody's
The thing
nodding their head. Yeah.
Here's the difference, because here in the United States, the education process for BSNs and ADNs, or the nurses, we've already started using case studies since 2 to 3 years ago. So the nurses that will be taking the NCLEX next year here in the United States are believed to be ready for the NGN. The problem is the foreign graduates, because the education did not really update, because I mean other countries do not have to follow the American curriculum all the time. So that's the problem. When these nurses, the foreign graduates, the international educated nurses, sorry about that, will take the NCLEX, they would have to do a little extra in preparation. Like Rachel said, the concepts did not change. You talk about myocardial infarction, it's going to be the same. Diabetes, it's going to be the same. Stroke, it's going to be the same. But the familiarity to the new types of questions, how they are scored, will be important. So yes, the contents are the same, but the test taking strategy will differ just a little bit, and that requires preparation.
Yes, definitely.
So really good advice and tips there. And I'm just thinking back to previous shows that we've done. I'm just thinking of a show that Dr. James was on, also an admin of the fora and an expert in this area. He did his PhD on how many international nurses pass the NCLEX, or why the international nurses don't pass the NCLEX at the same rate as an American grad. And the pass rate was not that high, just generally speaking, for all international nurses. So now this is going to mean even more important to prepare yourself. And I think that's a good place to move into the next segment of the show, which is where our experts are going to be taking us through a bonus class and sharing some of the tips and pointers specifically of how to navigate next generation NCLEX and prepare yourself as a nurse. And I'm looking at a comment that Mary made in the chat and said, that the NGN is not scary at all if the takers us mentally and emotionally well prepared. And I think, Mary, you're right. It's important to be emotionally and mentally prepared and to be positive, but it also is going to take work. So with that said, I'm going to hand over to our experts who are going to be taking you through the bonus class now for the next 30 minutes. So thank you so much for doing that.
Thank
If
you,
you
Tanya.
are joining us now, please feel free to continue to put questions into the chat for our experts, because they have agreed after this show to go into the chat and answer any questions that we were not able to get to. So again, thanks to Rochelle and to Dr. Nurse Paul from my side. And thanks again to the Lafora admin team who do such an awesome job of nurses helping nurses. And I'm going to hand over now to the team to do the next step of the show with the bonus class. Thank you, everybody.
So Tanya, it will just
Thank,
be Dr. Paul who
Yeah.
will be doing the bonus class, because I will not be doing the rationalization because I'm not an educator. It's my educators in the Hypasol Review and Mentoring Academy.
Yes, yes. Thank you, Rochelle. Thank you for clarifying.
thank you,
So
Tanya. Thank you, Rachel.
thank you, Rachel, and thank you, Dr. Paul. Thank you, everybody, and we will see you next month on the Lafora Talk Show, where again we will be having nurses come in to help nurses, empower you with information, pointers, and tips so that you can too live your American dream. Thank you, everybody.
Thank you.
Thank you. And thank you, Tanya. Thank you, Rachel. And before I continue with the bonus class, I will be going through Tanya's last question, which I was not able to really answer, but I've prepared a slide for it. These slides I've also shared on my show, the Dr. Nurse Paul Show, which I actually piloted last month, last October. And I do this every Saturday, 8 a.m. Central Time. But since you guys are already here and some of you have questions on the comments, the changes are here. I'm going to breeze through it real quick and stand by with me, because after this, I'm going to do a sample question and we're going to rationalize it together. And this will be interactive because I would need you guys to help me answer the question that I'm going to be showing you. And this question is actually patterned with the next generation NCLEX. We've been talking about next generation NCLEX, but what does it really look like? And what does it really feel like? So you're going to help me whether you've passed your NCLEX in the past, whether you're actually practicing as a nurse right now, or you're about to take your NCLEX soon, or in the future. Help me with answering the question that I will be doing in a little bit. But what are the changes to the NCLEX with the NGN, Next Generation NCLEX? Like I said, I've shared this in my own live show, the Dr. Nurse Paul Show, and I'll talk to you about it later. But there will be 14 new types of questions, which is actually flashed on the screen right now. And I'm not gonna go through all of them, but later I'm gonna use one type of question. It's called the bow tie, and I'm gonna explain why I chose that and how to answer that question. It's a very special type of question. The number 7, it says bow tie. We're gonna use that later, and I'm gonna tell you how to answer or attack that question using test taking strategies that I've developed for you guys. Now, there will be standalone questions, and the most anticipated change are the case studies. And this Saturday, I'm going to do a live show where I present to you an evolving case study to tell you guys how to answer that type of question. The minimum items beginning next year will be 85 items, and the maximum is 150 items. You have to consider that 15 items of these questions are not scored. They are called pre-tests, but even then, you would not know which are pre-tests and which are actually scored items. So don't worry about it. You're going to take 85 minimum, you're going to take 150 items maximum, and the time limit is still 5 hours. And in an 85 item question, again, 15 items are pre-test, so there will be 70 items that are scored. 52 questions will be stand-alones, which means it's not a case study. It's going to be by itself. 18 questions will be case scenarios. This will be part of 3 case studies, and each case study will have 6 questions each. If you're getting confused what case study looks like, I'm going to do a show this Saturday. So please join me online in Facebook and YouTube. I'll be announcing that later. And there will be 3 types of scoring: the 0/1 scoring. I've discussed this in one of my shows in the past. My playlist is in YouTube, or you can also check the videos that I've posted in my Facebook. But you can also check it in YouTube. I've arranged it by playlist. It says there the secrets of next generation NCLEX, and the show is entitled Different Scoring System or Types of Scoring System. We also have the plus minus. This is one of the toughest type of scoring because it's gonna be correct minus incorrect. So if you get 3 items correct and 4 items incorrectly, then your score is 0. So you can totally get a 0 point out of 8 or 10 items, out of 8 or 10 points in an item. So very detrimental because it can pull your score down. Okay. And there's also rationale scoring, where the scores will be based on pairs or three pairs, all right, of answers. And I've discussed this in detail in my show. I've also provided sample questions based on these types of scoring. Now, in the NGN, lab values will be shown, which makes the risk reduction potential of the NCLEX be a little easier because it's going to show the lab values. Today, we're not seeing lab values in the exam. We do not see the normal values. But in the NGN, they will show the lab values. And the RN test one will change. There will be an increase in the items of safety and infection control and pharmacology. Currently, pharmacology is 12 to 18%, but now it's going to be 13 to 19%. So think about getting 1 or 2 more items. In the minimum items of 85, you get 2 more items of pharmacology. I know we all hate pharmacology, but that's the name of the game. We have to know what we have to know, and we have to know what we need to pass the NCLEX. The passing standard will be published on January 2023. So we do not know yet if the boards want to increase the passing standard, make it stricter or tighter, or lower the passing standard to make it a little easier. And when will the NGN be implemented? This will be on April 1, 2023. So for now, I'm going to be using my other slide. And somebody asked us there been any changes to the length of pass mark and number of questions. I just mentioned that based on the last slide that I used. So this is the show that I do on Facebook and YouTube. This is every Saturday, 8 a.m. Central Standard Time, or Central US time, because I'm based in the US. So I think in the Philippines, for my folks in the Philippines, it's about 10 p.m. in the Philippines. In Africa, because I have students in Africa as well, this will be somewhere around, I think it's afternoon, 2 p.m., if I'm not mistaken, 2 or 3 p.m. in Africa and Europe, based on your location. But I'm doing that show. Join me on Saturday because we're going to do case scenarios, and I want it to be interactive. Whenever I do my classes, and this is one of the demos that I'm doing, and I have pharyngitis because in the last 4 days, I've been doing classes in my own company in Aspire RN. I'm not only the CEO of the company, but I'm also the lead instructor. Just recently, I did a personal one-on-one mentorship for a student for the final coaching, and she passed the NCLEX. She just messaged me this morning. I woke up very happy because I was so confident that the nurse would pass, but even then, I'd still get, very excited when I get those news because I feel like I passed the NCLEX as well, right? But if that's something that you're looking for, personal guidance, personal mentorship, allow me to help you, or connect with Kinetics USA recruiters. Go to their website and apply for scholarship. and they can connect you to me, or you can also message me in Facebook. And so clinical judgment, we've been talking about this. There are steps of the clinical judgment. We have recognizing cues, we have analyzing cues, we have prioritizing hypothesis, we have generating solutions, we have taking actions, and we have evaluating outcomes. So these are also synchronized with your nursing process. The assessment part is the recognizing cues. The analysis, before, when I was a student, we call it diagnosis, but they don't really want you to do medical diagnosis. But I think that debate is actually confusing, because yes, we don't do medical diagnosis, but honestly, when you're practicing as a nurse, you're using medical diagnosis, right? When a patient has asthma, the patient has asthma. When the patient has stroke, the patient has stroke. So I really don't believe in nursing diagnosis, because as an ER nurse, I've never used it in all my practice in 15 years. And analyzing cues and prioritizing hypotheses are part of the analysis of the nursing process. Generating solutions is part of the planning phase. Taking actions is part of the implementation phase of your nursing process. And evaluating outcomes is part of your evaluation phase in the nursing process. So basically, this is just nursing process rebranded, changed name, all right, to fit the clinical judgment model. But this is now how they measure or score your exams based on this clinical judgment model or items, right? Now, somebody asked, what is the name of your Facebook page, Dr. Paul? My Facebook page's name is Dr. Nurse Paul. You see my handle there on the screen under me. That's my name, Dr. Nurse Paul, DrNursePaul. Or you can also follow my company, Aspire RN, and make sure you also follow Kinetics USA Facebook page and YouTube and LinkedIn, because we're streaming this show live in those social media. And thank you for everyone who's watching right now. Okay. Now, we're going to use the bow tie type of questions, and I'm about to flash it right now. Hold still and look at your screen right now. We're all going to answer this question. Okay. So there you go. So we have a bigger screen now. So the bow tie, look at the right side where you see the questions, right? You see like a butterfly structure. We're going to fill that out later, but we're going to read the situation together. This is a case study. But you know what's good with bow tie question is it's one question, but it answers the 6 parts of the clinical judgment model, from recognizing cues to evaluating outcomes. So bow tie question is a type of question that was actually piloted, all right, originally created by NCSBN, the state boards, for the NCLEX. So no other licensure exam has this type of question but the NCLEX RN or NCLEX PN, all right? If you're not an RN and you're a practical nurse, I'll be launching a PN review classes beginning next year, because a lot of people are approaching me about NCLEX PN. I can help you as well. I'll start to do classes for PN next year, but mostly right now I'm focused on the RNs. Now, in this type of question, there will be 5 things that you need to answer. 2 actions, action to take, 1 condition most likely experiencing or diagnosis, and 2 parameters to monitor. Okay? So the actions to take will answer your analysis, prioritizing hypothesis. Conditions most likely experiencing is your getting solutions or gathering solutions, and parameter to monitor will be your evaluating outcomes and taking actions. And by reading the case, you're actually doing your recognizing the cues. So what I'm trying to say is, if you complete the bow tie question, you've actually been able to perform all the tasks in the clinical judgment, all the 6 steps, from recognizing cues until evaluating outcomes. All right. Now, let's read this question together. This is a long case, so please bear with me. Okay. If you guys are still with me, this will take about 15 to 20 minutes. Can you put in your comments right now your current location and time, so I know where you guys are coming from? I know there are people that are watching us from Zimbabwe, from Ghana, from Saudi Arabia. But thank you for joining us today. All right. Make sure you are sharing this show to your Facebook page so we can reach out to your friends that are nurses as well. Because I'm about to rationalize this question with you, right? We have Mark from Philippines, we have Mel from Saudi, we have one Facebook user from Facebook Australia, another one from the Philippines. And thank you guys for joining me today. And um, we have Van from Kuwait, Leah from Qatar. We have someone from Ghana. I'm sorry, I couldn't pronounce the name. Gina from USA. Which part of USA, Gina? I'm in Houston, Texas right now. Rachel from UAE. Sarah from Zimbabwe. There are Facebook users. I couldn't see the names right now, I guess because of privacy issues with your Facebook accounts. From Philippines, Vietnam, Jasmine is from Australia. Someone is watching us from LinkedIn, and the person is from UAE. I couldn't pull out your name. We have Serenity from Philippines, Singapore, Kuwait, Jordan, Riyadh, Missouri here in the United States, Saudi Arabia, and more people from Philippines in Abu Dhabi. Thank you guys for joining us today. We're all over the world today. I guess we're covering all 6 continents with the exception of Antarctica because nobody lives there. But thank you guys. We have people from Asia, Europe, Africa, and the Northern Americas. I don't think I've seen someone from Southern Americas. Anyone here from Brazil? I usually have viewers from Brazil, Argentina, Mexico, Panama. But thank you guys for joining. Now, we're going to answer this bow tie question. Help me. There you go. We have Suriname from South America. So it's official. We're all covering 6 continents in the show today. Thank you guys for joining. Don't leave just yet. You're going to answer this question with me. I don't care if you're already an NCLEX passer. I don't care if you're already practicing here in the United States. But let's just see. This is just a little mental drill for all of you guys. And this is a preview of what I'm going to show on Saturday. Okay. The nurse is in the emergency department, is caring for a 79-year-old female client, right? On the first tab, we see the nurse's notes. At 12 o'clock, 15 p.m., the client presents with right-sided ptosis, facial drooping, right-sided hemiparesis, expressive aphasia. Client's adult child reports that the client recently had influenza. On assessment, skin is warm and dry, lung sounds are clear, apical pulse is irregular, bowel sounds are active in all quadrants. Client is incontinent of urine 2 times in the ED. Adult child reports that the client is typically continent of urine. Capillary refill of 3 seconds. Peripheral pulse is palpable 2 plus. Vital signs 97.5 Fahrenheit. Pulse 126. RR 18. Blood pressure 188 over 90. Pulse oximetry 90% on room air. Okay. Before I go to the next tab, which is history and physicals, can you guys put in the comment section what abnormal findings have you found in the nurse's notes? What abnormal finding? So if you're the nurse, what abnormal finding have you seen in the notes? Can you guys figure out? Give me 1 or 2 words or vital signs or assessment findings that you've found that is abnormal. I'm going to give you one. The ptosis is abnormal, right? Ptosis is like sleepy eyes, right? Ptosis. What else? Anyone else? Unstable. Anusha said the vitals are unstable. What exactly in the vitals are unstable? Give me objective symptoms. PR and blood pressure are both abnormal. Very good. Pulse is high. Blood pressure is high. Very good. What else? There's facial drooping. Very good. What else? There's right-sided hemiparesis. Very good. What else? Aside from vital signs, everybody else said vital signs. Aside from vital signs, oxygen saturation is low, 90%. Very good. I'm trying to determine your recognizing cues ability, the first step in the clinical judgment. There's facial palsy. Blood pressure is high. There's urine incontinence. There's hypertension. Let's move on from vital signs because everybody said vital signs. Aside from vitals, there's so much abnormal findings in here. Incontinent, low SpO2. There is expressive aphasia, right? Apical pulse is irregular, all right? Very good. Arrhythmias. So there, we've found the abnormal problem. So you were able to recognize cues completely. Do not just get fixated with vital signs. I know as nurses, when you see long contents like this, the first thing that you look for is vital signs. But there are also findings that are written in words, all right? So find the abnormal findings. and we're good. We found everything that's abnormal. All right. I think the capillary refill is normal. 2 to 3 seconds is normal. Peripheral pulses, palpable 2+, that is normal. 1+ is weak. All right. So very good. Now let's go to the history and physicals. All right. We're going to click the history and physicals tab and it will get us here. So what are our history findings? Neurological, there is a history of stroke 2 years ago. In the cardiovascular, there's history of hypertension, AFib, hyperlipidemia. Gastrointestinal, history of GI bleed 2 months ago. Endocrine, history of diabetes, and immunological, there was an influenza 3 weeks ago. All right. So what do you think? What do you think is what do you think is most significant here? Actually, all of them are significant, right? Stroke, high blood pressure, AFib, lipids, GI bleed, diabetes, and influenza, right? And see, look at this. The lab results, the only lab results that we have is random serum glucose, all right? And the result is 76. Is it normal or abnormal? Is it normal or abnormal? So you see in the next gen NCLEX, it will show you the normal values, right? So 82 to 115 is normal, right? So is the sugar normal? Yes. Yes. It's normal, correct? So what we say in ER, and of course anywhere else, this is emergency, right? It can happen in the floor, it can happen in L&D, it can happen anywhere. Whenever you have neurologic symptoms, do not assume it's stroke right away. Check the sugar first because it might also be hypoglycemia. Hypoglycemia has neurologic symptoms like dizziness and disorientation. But since sugar is normal, we're going to take out hypoglycemia as a differential diagnosis. So see, the NCLEX is now not only forcing you to diagnose through the analysis, but it's also forcing you to do differential diagnosis or prioritizing hypothesis. In the medical field, as nurse practitioners, we do differential diagnosis, all right? So what are the possible differential diagnoses? Let's answer the first question, all right? Let's go to the right side. It says here, the nurse is reviewing the client's assessment data to prepare the client's plan of care. Let's go to the question on the right side of your screen. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing, 2 actions the nurse should take to address the condition, and 2 parameters the nurse should monitor to assess the client's progress. All right. Now let's go to the first question. Let's go to the middle part of the bow tie. What is the question? Condition most likely experiencing. All right. And I've told you earlier, do we have hypoglycemia risk? Possibly. But the sugar is normal. So can we safely remove hypoglycemia? That's not part of the differential diagnosis anymore because the sugar is normal, right? What else can I remove? What else can I remove? UTI, right? If you go back to your history, there's no history of UTI here. What are the symptoms of UTI aside from incontinence? That's the only symptom that I see there that's possibly UTI. But UTI has fever or foul-smelling urine or the low turbidity urine. So the urine is cloudy. We don't see that in the scenario. So we're going to remove UTI. We're going to remove hypoglycemia. All right. What is your answer for the first question? Condition most likely. Anyone? 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 So we have 2 answers so far. I want more answers before I proceed. Let's talk about condition first. Check the blue, the dark blue options in the middle, the potential conditions. So some people said ischemic stroke. Some people said Bell's palsy because we remove hypoglycemia and UTI already. Bell's palsy or ischemic stroke? I want more answers. I've had about 15 answers so far. I want more answers. And make sure to share this show to your page so people can see this. And you can also tell your friends about it, okay? So the more we share this, the more we're helping our community. This what we're doing is a live class. This is free. We don't ask for payments here, but we just want to be able to serve our community. It's my way of paying it forward since I know I feel like I'm very blessed with my life right now. So this is my way of sharing to everybody what I can, all right, in the best way that I could. So we have stroke and Bell's palsy. Just pick one because it's only asking you for one condition that's most likely. Between stroke and Bell's palsy, all right, I would answer stroke. You know why? You know why? While Bell's palsy is possible because of the history of influenza, because the symptom of ptosis and facial drooping, what makes ischemic stroke the answer versus Bell's palsy? All right. Did you guys see two things? Expressive aphasia. Expressive aphasia, Bell's palsy, all right? Go back to your pathophysiology. Bell's palsy is the inflammation of cranial nerve number 8 on the face, all right? It does not affect the speech center on your frontal lobe. If there's expressive aphasia, that's not Bell's palsy. That's possibility of stroke because the stroke might be happening on the Broca's speech area. That's why there is expressive aphasia. All right. And the other finding that makes me suspect stroke versus Bell's palsy is what? Hemiparesis, one-sided paralysis. Again, Bell's palsy, go back to your pathophysiology, right? Bell's palsy is the inflammation of cranial nerve number 8, facial nerve. The facial nerve does not control your arms and legs. However, the spinal cord and the brain, motor area, motor neurons, control your arms and legs. So if there's aphasia and hemiparesis, is this more likely stroke or Bell's palsy? Is this more likely stroke or Bell's palsy? I'm sorry, I'm very persistent with asking questions. When I teach, I like it to be interactive. I don't want to be answering the question that I already know. I want you guys to help me analyze because it's all about you. It's not about me. I want to improve your thinking process. So is it more likely stroke or Bell's palsy? Very good. It's stroke because Bell's palsy does not have hemiparesis and expressive aphasia. So the first answer is ischemic stroke. For those who got this correctly, you get 1 point. For those who did not get it correctly, you get 0 points. This is a total of 5 points, okay? So you get zero. You get zero, okay? Zero. All right? Now, we're going to total your score later. Next, we're going to go to actions to take. Considering that you are thinking of stroke, give me 2 actions that you think we should prioritize. Your options are on the left side. It says administer oxygen at 2 liters, request a prescription for steroid, insert peripheral venous access device, obtain urine specimen, or request an order for 50% dextrose. What is your answer? What is your answer? Give me two actions to take, 2 actions to take, 2 actions to take. Very good. I want more answers. I'm looking at your answers. Somebody said, I could not see all the names in the comment section because of your privacy settings in your social media, but people are participating to us from YouTube, LinkedIn. I'm very happy with this. We're reaching a lot of social media today. And Facebook. Some Facebook users said oxygen access device. Somebody said oxygen. Somebody said access device. I need 2 answers, 1 and 3. Okay. So, guys, when you have stroke, what are the managements that you're thinking? What are the managements you're thinking? You want to tackle ABC, right? Airway, breathing, circulation, right? Why? Because stroke is basically oxygen problem to the brain. You want to give oxygen, that's correct. You want to give, you want to monitor neurologic status if they're complicating. You want to assume that you might want to give IV fluids. You want to give antihypertensive if the blood pressure is too high. You might want to give, what medication are we going to give? Supposing the most common cause of stroke is clots, right? What medication are we going to give to dissolve those clots? We call it clot buster. Anyone here working in the neuro ICU, ER, ICU, neurologic floors, what medication are we going to give to dissolve those clots? To dissolve those clots? Anyone? Thrombolytic, right? No. Aspirin and anticoags heparin. Plavix is an antiplatelet. they do not dissolve clots. I said we need to give something to dissolve clots. So see, we're not only using your pathophysiology and assessment skills here, we're also thinking about your pharmacologic intervention here. What is that? We call it alteplase. The other name is TPA, or tissue plasminogen activator. Again, anticoagulants and heparin, all right, or aspirin or Plavix, clopidogrel, they do not dissolve clots. I need something that will dissolve clots faster, and that's TPA or alteplase. Now, how do you give alteplase? Do you give it by IV? Do you give it through the IV? Yes. So the answer, we're about to wrap up, is twofold. Administer oxygen 2 liters and insert venous access device. All right, two. Right. So by giving oxygen, you're treating the airway and breathing problem, and by putting an IV device for medications, fluids, antihypertensive, alteplase, you're also managing the circulation. All right. Very good to June. I do stroke lectures, but this is not it today because stroke is a different question on its own. But yes, it's weight based. All right. It's zero point 0.9 milligram per kilogram, maximum of 90 milligrams, and it's administered 10% bolus for the within 1 minute, and the remaining amount, the 90%, will be administered over 1 hour. All right, so count your scores now. I've given you 3 points so far. Some people only gave me one answer, so that gives you another point. Some people gave me two answers, so that gives you 2 points. All right. Now, let's go to the final question of the bow tie. Are you loving Next Gen NCLEX? I'm so excited with Next Gen NCLEX. You know, guys, I'm not working as a nurse right now. I just finished my Hawaii travel nursing contract 2 weeks ago, 3 weeks ago. And all I did on my free time, all I do in my free time is sit down and write case scenarios every now and then. So I would write 6 questions every now and then. So I've gathered 20 questions, no, 20 I'm sorry, 24, because it's 6 questions each. 24 questions so far. So I'm writing my own questions, okay? Because that's how I teach. I write my own questions, and I love writing questions. I've been an educator and NCLEX instructor for 16 years, and I bring in a lot of experience. And how I teach is because of my experience and because of I've developed this skill for a long time. Anyway, so what are the parameters to monitor? Give me 2 parameters to monitor. All right. So definitely I've mentioned neurologic status earlier. So that's 1 point. What else? What else? What else? Earlier, I asked you about what abnormal findings you found in the situation in the nurse's notes, right? That's recognizing cues. And then we identified what diagnosis it is. So that's your analyzing cues. And the third step in your NGN, clinical judgment model, is prioritizing hypothesis, right? And then now we took action by providing your intervention. That's your gathering, um, gathering and taking actions, the fourth and fifth step. Now we're down to the final step of the clinical judgment, evaluating outcomes. What do I need to do? Do I need to monitor temperature? What was the temperature earlier? 97.5 Fahrenheit. It's normal. I don't need to monitor that. Remove temperature. What else do I need to remove? Remove serum glucose level, right? Because sugar is normal. So now you're down to 3 choices, but I need 2. So neurologic status and what? And what? Some people answered urine. Do I need to answer urine? Yes or no? Do I need to answer urine? You would answer urine if your differential diagnosis is UTI, right? Right? You would answer sugar if your differential diagnosis is hypoglycemia, right? Right? You would answer Bell's palsy, temperature if your differential diagnosis is Bell's palsy or UTI, right? So the answer is actually neurologic status and EKG, all right? In the actual NCLEX, you're gonna drag these boxes up. You're gonna fill in the boxes by dragging. It's drag and drop, drag and drop. I just couldn't do it because I'm using an app right now that does not allow me to do it. Now, question, why do we need to monitor EKG? You found 2 abnormalities in your nursing notes earlier that you've mentioned to me. two abnormalities in your nursing notes that led me to decide we need EKG, right? It says there the apical pulse is irregular and the pulse rate is 126, all right? Go back to your history. Okay, I know you guys got 4 or 5 points, but go back to your history. Did you remember that in your history you said, all right? I'm sorry, in your history, you said that the patient has atrial fibrillation, right? And atrial fibrillation can increase the heart rate and make your pulse irregular, right? And atrial fibrillation can create clots. Clots can cause stroke. So the AFib is causing stroke. So do you need to monitor EKGs? Do you need to monitor EKGs? Yes or no? Yes. So the answer, our final answer would be neurologic status and EKG. So what am I telling you? Yes, I know you got the answers correctly, but NGN wants you to be able to connect concepts, all right, through clinical judgment and critical thinking. It does not want you to guess. Guessing this time does not work because some of the questions are correct minus incorrect. If you guess, you're going to have penalties, all right? But it wants you to connect your pathophysiology, your knowledge about pharmacology, your knowledge about physical assessments, your knowledge about your nursing interventions, everything together. All right. Now, here's my question. Who got 5 points? Who got 5 points? Anyone? Who got 5 points? Or 4 points? 4 and 5 are passing. Those who got 1, 2, and 3, well, that's not a really good score, but it's okay because you still have 5 months to prepare for NCLEX, next gen NCLEX. All right. All right. Mark Madrigal said, and he's right. If the diagnosis is wrong, everything else follows. You are correct. All right. That's why clinical judgment is very important here. All right. And who's going to be taking their NCLEX this year? You are lucky because you're not going to do NGN. Anyone taking the NCLEX this year? But who are taking the NCLEX next year? All right. If you're taking the NCLEX next year, you might want to join my free classes that I do. All right. But anyway, join me this Saturday. If you guys have time, please join me. Thank you, Kinetics, for hosting this show. Thank you for allowing me to share my expertise. Thank you, Tanya and Rachel, for being with me today. Thank you guys for joining me and allowing me to explain to you what bow tie question is, but that's only one question. We have 14 different types. There are more sample questions that I will be doing on the show this Saturday, 8 a.m. Central Standard Time, live on Facebook and YouTube. Follow me on my Facebook at the Dr. Nurse Paul, Instagram, TikTok, and YouTube. Okay. And this is a major announcement that I'll do. On my show this Saturday, one lucky winner will get an NCLEX Unlimited package that includes personal mentorship by yours truly, the Dr. Nurse Paul. All right, allow me to help you. If you want scholarship and you don't have funds to finance your NCLEX review class, let me know and join my show. You may be able to win the raffle. I do the raffle almost every week. So make sure to join my show, follow my page so you can see if I'm doing the live, and share it to your friends. Check the mechanics online. You might win. And if you guys, somebody asked me, do you guys have crash course or rapid courses? I'm going to take the NCLEX next month. I'm going to take the NCLEX in the next 3 weeks. Yes, approach me. Message me in Facebook, message Aspire RN in Facebook as well. I have my team on standby there waiting for your message. And I will be able to help you, connect you to resources. If you are interested with scholarships with Kinetics USA, do we have the link down here if where they can apply? I think it's kineticsusa.com/apply. All right. But Kinetics USA will message it to you in the comment section if we cannot flash the link right now. But we offer scholarships as well. Or you can message me as well, all right? Because I can also connect you to Kinetics USA. I've just connected to them several nurses that I've chosen as a scholar, but you have to take the eligibility exam. It's the same process as going through Kinetics USA, but I can also help you with that. I do a lot of information sessions, free classes. You don't have to enroll to my classes, but I do master classes online as well. All right. If you have more questions about NCLEX preparation, that's something I can help you with. If you have questions about living your lives in the USA, I've been here for 6 years. I'm now an American citizen. I have my own house, car. I'm living the life of my dream. And if I can do it, you can do it as well. Thank you guys for listening. Thank you for joining Onwards and Upwards. Thank you, Tanya. Thank you, Rachel. Thank you, the Kinetics USA team. And I'll see you soon. Saturday, 8 a.m., the Dr. Nurse Paul Show. Bye.